All right, welcome back, everyone. In just a few minutes, we will be live with Dr. Bonnie Henry and Adrian Dix with the BC health officials with an update on what is going on with COVID-19. So please stand by and hold while we bring that report to you live here in British Columbia.
Today, Monday, as well as Wednesday and Friday. On Tuesday and Thursdays, there will be written briefings with case counts and other relevant information about COVID-19 in British Columbia at around 3 o'clock. And with that, I'm honored to introduce Dr. Bonnie Henry.
For today, we are reporting on the 3 periods from Friday to Saturday, Saturday to Sunday, and Sunday to today. From Friday to Saturday, we had 713 new cases of COVID-19. Saturday to Sunday, and two healthcare outbreaks in the North Peace Senior Housing, Queen's Park Care Centre, Care Life Fleetwood, Sunset Manor, Renfrew Care Centre, and Lionsgate Hospital. 2 outbreaks have been declared over at the Nanaimo Regional General Hospital and Evergreen Baptist Care Society. That leaves us with 60 active outbreaks in our healthcare system, 54 in long-term care and assisted living, and 6 in acute care. We now have 970 active cases in long-term care, including 583 residents and 365 staff. And that is a very sobering thought for us, knowing how challenging our long-term care outbreaks can be. And that really speaks to where we are right now in our pandemic here in British Columbia. It is the most challenging of our time, and we are all feeling the strain. This virus doesn't pause, though, when we're tired and frustrated and we want it to be over. And it doesn't pause when we're out with our friends, our family members, those we care with. It spreads quickly and doesn't wait for us to catch up. I say this not to give up hope, of course, because I do think there is hope, but to remind us that we have the knowledge, the tools, and the resources to control this virus and not let it control us. I say this to fuel that fire of determination and resilience that I have seen in people across this province. That when we see these challenges, we all think about what can we do today to make a difference. And right now, that means doing a bit more to get over this hurdle. Over the next 2 weeks, we need to urgently reduce the level of transmission in our province to keep our schools and workplaces open and relieve that very real stress we are seeing right now on our healthcare system. That means reducing our social gatherings, our social interactions and events. Protecting our hospitals, workplaces, and schools is the important thing we must focus on now. We have been learning. It's not the same as it was even a few weeks ago, as possible, where we are seeing transmission of the virus, particularly indoors, but it is to those people we are closest with, whether at work, at home, our social family, our social connections. I'm asking you to put the safety measures at the top of your list every day, rather than thinking about where the gaps are, where the shortcuts are, is there a workaround, is there a way I can get around this order. Simply put, we all need to focus on making a difference today. In our homes, we should only be with our immediate household, those people we live with. That means no visits, social visits from extended family or friends. Yes, it does mean you can help your mother if there's a concern. It does mean that you can carpool to take your children to school. It does mean that grandparents can care for children. But what we mean is no hosting of gatherings, no dinner parties, no backyard barbecues, no play dates right now. This next 2 weeks is critical for us across the province. But I do know connection is important, and that's why we've said if you live alone, you can, of course, have those 1 or 2 people that are in your close bubble that you have close connection with, whether that's a partner, a relative, a friend. And of course, we know that there's connections with co-parenting and other important connections. You can also go for a walk, go for a bike ride with a friend or 2 friends. Go outside with your family. We've said this from the very beginning, and it's important that we continue to look after our mental health and our physical health. Get outside, go for a walk, keep your distance. Take advantage of when we can get outside and the places that are in your community to let off some of that concern, to get some physical exercise, to have that time with people. I have also suspended all events as defined in my gatherings and events order. And that apparently needed some details in it. So with the exception being funerals, weddings, and ceremonies such as baptisms, which have increased restrictions on them. But it does include events at hotels, restaurants, bars, and does include movie theaters and cinemas. I know this has meant delaying the opening of some very great and well thought out seasonal events like the Holiday Train in Stanley Park and the Bouchard Garden Light Display, among many others that had previously been approved across the province. Those are suspended. We need to monitor what we are doing right now. That is the next thing is not quite in sight, which means we need to gather our focus and our energy together now. When vaccines are approved and available, we'll be able to transition to our next phase, to that run that will have a finish line, to get into our rhythm and to steadily move forward. I understand that this pandemic is tiring, and the orders make it more difficult. We don't want to have these things in place. But right now, we need to focus on today. Focus on the intent of what we're trying to do right now, which is stop those transmissions from happening, reducing our connections so that we can get through this phase of the pandemic together. Instead,
Vancouver Coastal Hotline, I think I speak for everyone in the province when I say that we send our condolences to families who are struggling with this right now. It is a very, very difficult time to lose a loved one under any circumstances, but particularly due to COVID-19. And every person matters, every case matters, and when we lose 17 people, that is a profound loss for us, one that affects us greatly here. And we want to say to everybody that we are thinking of them and we are with them in this difficult time. I know that people in healthcare are working extraordinarily hard. Dr. Henry talked about the 7,360 cases, the 10,200 people who are self-isolated and under public health surveillance. Region, conference, lecture, talk, educational presentation, except in a school or post-secondary educational institution, auction, fundraising benefit, contest, competition, quiz, game, rally, festival, presentation, demonstration, athletic, sporting, or other physical activity, exhibition, market, or fair, including a trade fair, agricultural fair, seasonal fair, or episodic indoor event that has as its primary purchase the sale of merchandise or services, e.g. Christmas craft markets, home shows, antique fairs, and the like, and for certainty, including a gathering preceding or following another event. And that is available and the most recent version of it, because it's been amended, is available under PHO Order November 10th, page 3. And I think what it says is that what we're trying to do here, and these are all both religious and secular events, of course, of all kinds, except with weddings and funerals and baptism, where we have a maximum of 10 people, which is itself difficult, but that is an exception from the rule. Is what we're asking people to do is to reduce social interaction in this period, that this is one of our means in our calm, considered, compassionate, thoughtful, science-based, and massively resource response to COVID-19 in BC. These are the means by which we together